Prostate problem has been a cause for worry to almost all elderly men in recent time. In fact, it's more like a nightmare. I have had cause to sympathize with some families, who lost their loved one to prostate cancer, just as I have had cause to, congratulate some families who kind of beat cancer, or I would say prostate-related problems. Be that as it may, this is a topic that has become apt in our society today, as far as the health of men is concerned. I am Dr. Austin, a family physician, the medical director of Armstrong Hospital, and tonight I will be discussing prostate health with you. I am doing this painstakingly. There's a long overdue presentation. I remember a long time ago, I promised doing this presentation from popular demands, and I wasn't able to meet up. I failed several times, not because I never wanted to do that, but my commitment. Just yesterday, I decided I was going to do it, and I made all effort, and I got hooked to my system. As I was about to start, noise from nowhere just came, a rush into the hospital. An unconscious patient who just fell was brought in, and I had to stop and attend to this patient. Apparently was sick, but didn't do anything about his health. And while he was out doing one thing or the other, he fell and hit his head on the ground. And the impact was quite serious, to the point that there was a suspicion of bleeding in the brain, because his respiration and also his heartbeat were not regular. So obviously, he was probably having one-time hemorrhage. Anyway, after all efforts, I couldn't guarantee his safety. I had to refer him to our, centers. I couldn't get composed again anymore to continue the presentation. And I said, today I must do it. And guess what? This is past 2 a.m. Past 2 a.m. I said, if I don't do this presentation, I'm not gonna sleep. I must do it. Let me be done with it once and for all. So this presentation promises to be quite, enlightening, quite resourceful. You're gonna learn a lot from it. There are many things you may not have thought could be related to prostate health that you're going to be hearing, from this presentation. One of them is the role of sex in prostate health. I'm not going to tell you whether sex helps to reduce the risk of prostate cancer or increase the risk of prostate cancer. You will get that towards the end of the presentation. So also, we hear in women that their cervical cancer is caused by a virus called human papillomavirus. It may interest you that there is an ongoing suspicion of the fact that this same virus could be responsible for some prostate cancer. Isn't that amazing? Anyway, let me not talk too much. Let's just kickstart, as I'll be sharing my screen right away. Okay, this reminds me, during the heat of COVID, I had to do this presentation to an organization of men. And if you look at the date, it was September 26th, 2020. That was my first presentation, public presentation on prostate. But now I'll be taking it to another level because my knowledge on prostate has very much increased from what it used to be as at September 26, 2020. So, okay, the first question is, what is prostate? What's the prostate? The prostate is a walnut-sized gland at the base of the male bladder. Of course, you can see this structure, this diagram. Of course, this is a male, picture, a male diagram. The bladder is the organ that retains the urine before urine gets out of the body. Of course, you see there's a tube right above the bladder. The one should be on the other side. Okay, the two of them are coming from the kidneys. The kidneys produce urine. And once the bladder is full, the urge to urinate, is ignited. And one goes to a convenience and pass the urine out. Because as you can see the structure here, the prostate surrounds the urethra. The urethra is the tube that connects the bladder to the penis where the urine is passed out. And this structure that you see, it's like kola nut. I prefer to use kola nut to describe the structure of a prostate, a big kola nut. But actually, if you know what a golf ball looks like, those who play golf, that white, hard ball, usually that's an average size of the prostate. Okay, what does the prostate do? It produces fluids to support sperm during ejaculation. As you can see, beside it is the seminal vesicle where the sperm is being produced. And once there is an ejaculation, some contractions take place. The sperm from the seminal vesicle is released into the urethra. So also the prostate will also release its own fluid to mix with the fluid coming from the sperm, from the seminal vesicle, and it proceeds, during ejaculation out of the penis. Prostate grows to its normal adult size in a man's early 20s. It begins to grow again during the mid-40s. So there are two growth phases of prostate. We have the early phase, to the normal adult size, during the 20s, maybe the age of 20 to up to 29. And it stops at that size. But by the time one gets to like the age of 45, 46, it begins to grow again. One wonders why this is happening. Why can't the prostate just remain where it is and we are at peace? Okay. So what are the conditions that are associated with the prostate glands? We have three main conditions that are associated with it. One of them is enlarged prostate, which we also call benign prostatic hyperplasia. You may not bother with the medical jargons that I'll be speaking here today. And of course, I'm being conscious of, overwhelming you with some of these medical jargons. So I will limit them as much as possible. This is just simply an enlarged prostate. It is not a swollen prostate. It is an enlarged prostate. This distinction is very, very important because what we expect from whatever is swollen is a fast regression. Anything that swells tends to reduce in size within a short period. So there are some people who tend to adduce to the fact that the prostate is swollen, and they give you treatments that will maybe, do something. Most times they happen in unorthodox practice. So this is to correct that notion. It is real growth. And there are several. We have what we call hyperplasia. The cell can grow big in size. There's also a form of growth where there are increase in the number of cells. So the other type of prostate problem we may have is when it is infected. And this is called prostatitis. This will respond to antibiotics, and then the symptoms will be relieved. We also have prostate cancer. Prostate cancer is the most feared prostate problem. No one really wants to have this. And this is increasingly noticed, even among the younger ones. And it's quite painful, to have this reality. Anyway, these conditions are treated differently. That is why it is important to diagnose appropriately what exactly we're dealing with, so that the treatment can be appropriate. Of course, I won't bore you with this. This is essentially, enlarged prostate. Of course, it is not a cancer. It is just big. It is enlarged. The problem with the enlargement is that it's going to disrupt some of the functions of the urinary system, especially the urethra, where the urine passes. Okay, the normal adult size is approximately 1.5 inches in diameter. And if you can figure it, it's more like the size of that golf ball I talked to you about. Okay, benign prostate hyperplasia or enlargement can lead to bladder outlet obstruction, which can cause lower urinary tract symptoms. Okay, I will explain further what this means. When you have, let me go further to a particular diagram. Okay, now, if you're looking at this diagram right now, here is the bladder, and here we have urine in the bladder. This is more like 1/4, full. Okay, probably on its way passing out. Now, this is the prostate down here. Where you have this prostate so enlarged, it begins to obstruct the passage you're seeing here. So urine cannot flow freely. So this is the bladder, and this is the bladder outlet, which you saw on the other slide as BOO. Then lower urinary symptoms are symptoms that are associated with, obstruction of the flow of urine out of the bladder. And what are those symptoms? Most of the time, may have frequency. I think let's go to the appropriate slides so we do not miss anything. Now, there are some things we have to clear from some misconceptions we need to clear here. BPH, which is enlarged prostate, does not mean prostate cancer. This is quite important to take note of. Of course, it also does not cause prostate cancer. It is not a prostate cancer and is not a prerequisite for a prostate cancer to develop, okay? The symptoms, though, are similar to those of prostate cancer, because where you have cancer, there is kind of enlargement or increase in size or even blockage of the urinary tract from the effect of the cancer. Their symptoms can really overlap, okay? Of course, it may coexist with prostate cancer. In other words, the processes that lead to prostate cancer occur independent of the processes that are responsible for enlarged prostate. A prostate may be enlarged and cancer somewhere in the prostate is growing. A prostate may not be enlarged and cancer somewhere in the prostate is developing. Okay, so they are not to be confused with each other, and they are mutually independent, if you understand that grammar. Okay, now prostate-specific antigen levels alone do not distinguish BPH from prostate cancer. Both BPH and prostate cancer can cause elevated PSAs. So in other words, there is this usual screening. We'll get to that point here. There's a usual screening we do. It is a test of the blood. There's an antigen, more like a chemical stuff that is released by the prostate. Usually is found in the blood. So we have devices for testing for the level of this element, this substance in the blood. So the fact that you have this substance in the blood does not tell you that automatically this person has cancer or person has benign prostatic hyperplasia, okay? It is only reflecting that there is something wrong happening, with the prostate. And further investigation will be necessary to know which of the problems, okay, are responsible. But however, there are levels of PSA you will find that will automatically confirm cancer. For instance, someone with PSA level of 2000, I don't need any other confirmation. This is just pure cancer. Okay, there's no way benign prostatic hyperplasia will give you a PSA of 2000. Okay, so this is an exception. Now, as the prostate enlarges, pressure can be put on the urethra, causing urinary problems. Now, this is an opportunity to explain what we wanted to explain the other time. Now, just imagine, here's a normal prostate, and if you can see the diagram very well, the bladder has urine in it, and the passage is open, so urine can flow out easily. But for an enlarged prostate, the second diagram or picture, you see that the prostate is so enlarged that the enlargement has taken also the space where the urethra is supposed to, be, and there's a total collapse of the urethra. Now, urine is collected. You can see that urine, the bladder is more full where we have the enlarged prostate. And so the urine is retained and cannot pass through. And if urine continues to, flow from the kidney into the bladder, it gets to a point that the bladder is totally full and the urine begins to go back, the pressure begins to go back to the bladder and to the kidneys. And that can lead to kidney problems. That can lead to kidney stones. That can lead to infections. That can lead to frequent urination. Of course, it depends on the level of obstruction. If it is a total obstruction, there will be total inability to void, to pass urine. If the obstruction is not so serious, you discover that there is a pressure. Once the pressure is quite high enough, it pushes some urine out of the bladder. But when it gets to a point that the urine in the bladder is not so much to constitute a pressure that can force urine past the partial obstruction, urine then remains in the bladder. So you have the feeling that you have not emptied your bladder fully. Okay, and by the way, if this is what is happening, definitely you expect a bladder that is not totally empty to get filled up sooner than, expected. And this leads to whoever is having this issue visiting the convenience of the toilet more frequently. For instance, if it takes 2 hours to fill a bladder and you have a half-filled bladder already, definitely 30 minutes will fill the bladder. I'm just using that as an example. So if ordinarily you should be going to visit the restroom, every 2 hours. You may find out that you are visiting every 1 hour. And if it gets so serious, you might even be visiting every 30 minutes and all that. Then if you now have infection, which is part of what may happen, irritation of the bladder will also provoke the urge to want to go and urinate, okay? And here we are with the symptoms: frequent urination during the day or at night, sudden urge to urinate, and most times is due to the infection part of it, because I won't say the bladder is sterile per se. There are some bacteria that could track from the urethra, from the penis, gradually up. You actually need to be urinating very frequently to be able to prevent such infection. When you urinate, you take enough water and urinate frequently, bacteria don't have, that time and opportunity to, migrate from the urethra to as far as the bladder, because urine is constantly flowing in one direction. And also, urine is not too sterile. Of course, bacteria and everything could find their way in the urine. If a contaminated or infected urine is kept in the bladder, then bacteria will multiply easily. And these are the basis for infection, so to say. Okay? You may have burning, painful urination. These are also signs of infection, all caused by obstruction. You may have weak urine flow. Yes, we have this common knowledge of the fact that children can decide to raise, their penis upwards while urinating and form a kind of fountain of flow of urine, such that their urine can go up and come this way. But adults cannot do that. Why? Because they're already having a enlarged prostate who is clamping down on the urethra and reducing the pressure with which the urine can come out of the body. So if it gets so serious, in fact, some people use a kind of hole your urine can dig on the ground, where you have soil and all that. The more the pressure, the more it can dig into the ground. So when you have a weaker, flow, it drops. And there are devices to even measure the flow rate or the pressure with which urine is coming out. All are also in a bid to diagnose enlarged prostate. Okay? You may have sensation that the bladder is not empty after urination. I mentioned that. Inability to urinate totally. Of course, we have had cases where people get rushed to the hospital. What happened? They woke up and they've been trying to urinate. They made all effort and urine would not just come out. Of course, this is a situation where the obstruction is really complete and we have to come to, their aid for them to be able to pass urine. You can have trouble stopping and starting of urine flow. Yes. The question is this: you feel like you want to urinate. You get to the place, and to start you require some time, to kind of pet your bladder, to apply some, pressure within. Eventually, urine begins to come out. And once urine begins to come out, because it does not empty fully, there is no point where there is a stoppage of the urine flow abruptly. Okay? And that's what this statement means. Trouble stopping and trouble starting. Okay? I hope you're following. Here we are on this diagram again. So let me use this opportunity to also repeat what I mentioned earlier. Here's the bladder. You have urine here, and this is the prostate, and this is the urethra through which urine passes. and beside it is the seminal vesicle where sperm is being produced. And once during sexual intercourse, ejaculation is going to take place, there is some kind of contractions, and this seminal fluid passes through this to enter this urethra. And in the process, the prostate also contracts to release its fluid, and they all meet mixed up and get out as an ejaculate. That means that looking at this structure, because we'll come to that later, so I may not have to come back here again. If anything is happening to this structure, you definitely know that it will also cause problems with sexual function. Imagine it is also preventing the sperm from coming out freely. There could be problems. I just want you to just have that at the back of your mind. Of course, many men who suffer from BPH may experience a reduction in quality of life. That is very true. Of course, you are aware that you don't have the freedom of going to urinate at the appropriate time when the urge comes and ending it. Because of that, you start losing interest in so many things about life. To even start with, you don't even want to take enough water. And we all know how healthy it is to take enough water. So you don't want to take enough water because you want to reduce the frequency with which you urinate, and that will be impacting your health. And from that, you could be developing some other health problems, okay? You don't want to attend events. You don't want to go to the theater. Even sex, sometimes you lose the interest. So many things are happening. I just want to be brief, okay? There are some statistics you may look at. Of course, sleep may not be good enough when you have to wake up several times, in the night and all that. And outdoor activities are not your interest. You feel embarrassed when you have to keep getting up every now and then. You want to go and urinate. You just all the same abandon those activities, and that will be impacting your health. Remember, being active is more like you're exercising your system, and it makes you more healthy. Okay, here are some statistics we may need to look at, which are quite important. Okay, who are those who are likely to get BPH? They are not, of course, men. It can be women, it's men. 50% of men over the age of 50 are likely to have an enlarged prostate. We also have 40 to 50% of men ages between 51 and 60. Affects 80% of men over the age of 80. So what you can see is that the older you get, the higher the percentage of the men in your age group that are having this prostate issues, especially above 50. Okay. Now, how do we make diagnosis? Usually it starts from history taking. We hear your complaints, and usually what we hear is that all I have mentioned, inability to urinate frequently. Presentation in this part of the world is usually late. The problem would have gone too far before we start having complaints, except where we have people with urinary symptoms, maybe infection, they are feeling some hot sensation, and sometimes those symptoms might be the first signs. Someone keeps coming, having infection in his urinary system. Definitely you want to investigate further to see if it's really due to obstruction, and that might be an early presentation. Or sometimes it's late even, okay? After history taking, we do physical examination, usually the digital rectal examination. I remember those days in medical school where we are made to understand that it's really a crime when you examine a man and you have not stuck your glove finger into his anus to check his prostate, because at every opportunity you meet a man, especially when he's above 40, you want to diagnose him. And we hear from the the advice that men above 40 should go for regular prostate screening, and that includes digital rectal examination. We also do prostate-specific antigen. I think the popularity of digital rectal examination is going down, while the prostate-specific antigen testing is coming up. A lot of men are not comfortable with the examination of their prostate. Usually, when you have to stick a finger into their anus, it's quite discomforting to them, many of them. Not that it's a painful exercise, but you know, the way it is, you just can't imagine somebody sticking finger into it. Just imagine all men above 40 have to be doing this. Anyway, we have some controversies coming up, you know, questioning the need why all this should be done, but I won't want to go into that. It's not in the scope of today's presentation. Of course, we have urinary output testing. Like I mentioned earlier, you want to check the flow rate of the urine. You also want to check the volume. There is prostate scan too. Prostate scan, usually abdominal scan. The scan probe is able to view the prostate and even measure its size and give an idea if we have enlarged prostate. By the way, what do we expect to find when we do digital rectal examination? That is sticking the finger, a gloved finger into the anus. We want to feel the size of the prostate. Okay. We also want to feel the consistency of the prostate. Where we find out that the prostate appears to be large in size, we want to make a tentative diagnosis of an enlarged prostate. But where we find the edge to be, the surface to be rough, like actually rough as the surface of the golf ball, then you want to suspect more of cancer, especially when it is not large. And even if it is large, cancers still get big and all that. So that is what we tend to find when we do digital rectal examination. There's also value in self-evaluation of symptoms. That is, you want to check some of those. There are various organizations that have come up with there are various ways of assessing those symptoms of prostate presentation to be able to use that to make some assessment and grading. Okay, that is not the scope of this presentation. So this is example of what I was describing to you, digital rectal examination. Here is where the prostate is located. This is the prostate, okay? So through the anus, you can feel this point. If it is rough, you want to suspect more of cancer. And if it is smooth and enlarged, you want to suspect an enlarged prostate. Then if it is normal in size, is not rough, and then you think you may not be dealing with our program. Then if it is painful, then maybe we are dealing with an infected prostate. And of course, the next step is to actually take a biopsy where you probably have done a PSA and PSA is high, or you did digital rectal examination and you are suspecting more like cancer and all that. The next thing, you want to harvest some sample of that prostate. And what is usually used is a biopsy gun with a biopsy needle. And it also has an ultrasound probe. They are more like fixed together. The probe is to help the person visually sight that particular spot that is more suspicious, you know, to be abnormal tissue, so that part will be harvested, you know, very technically. And this is part of what is done to confirm if the tissue is cancerous or not. So what are the treatment options we have? One of them is watchful waiting. Of course, stroke, some medical therapies. There are some drugs that can be given that can help the smooth muscle to relax and probably to get reduced in size so that the urethra can have its freedom to accommodate urine passage and relief of symptoms. All this especially for enlarged prostate, not for cancer. So any obstruction that is as a result of cancer, the management is completely different. Of course, there are other processes involved in, reducing the size of the prostate. We don't really have to go deep into that. It also depends on whether we're dealing with prostate cancer or we're dealing with enlarged prostate. If it is prostate cancer, you want to remove the prostate all through, especially when the assessment is that it has not really spread much, okay? We have a surgery they call open prostatectomy. We also have a surgery where it is minimally invasive, or in fact, even a radical prostatectomy where you harvest some lymph nodes that are around the adjacent structures to the prostate. You want to remove them because they are likely to have to be harboring some of the cancer cells from the prostate. Okay, so for open surgery, there's usually a midline incision in this pattern, as you can see, from the navel down to the upper part of the pubis. You can also have the one we call phanestoid, which is more like transverse like this. It's more commonly done for women when they are going to have their babies for CS. So anyway, it is one of the incision that is shown here. The other incision could be transverse. And personally, if you ask me, I prefer the transverse incision because it goes with the creases, and when it heals with little scar formation. Okay. You also have some robotic surgery where the probes are put in through these holes that are dug through the abdomen, and somebody somewhere is using the hands, to operate some machine in such a way that the robot is doing it more perfectly. So you need to see the way this really operates, and this is what we see in more advanced countries. So this open prostatectomy is what we commonly do in Nigeria, though some people are acquiring the skill to do this robotic surgery, but I can tell you it's quite minimal in the country for now. Okay, American Urological Association recommends that no dietary supplement combination phytotherapeutic agent. There's what we call phytoscience, all those you hear them say stem cells and all that from plants, agents from plants and all that, as they're called supplements and stuff like that. Maybe herbal therapy. I will categorize this as under herbal stuff because anything phyto has to do with a plant. So this is a technical name trying to tell us that there is no evidence that herbs or supplements or other non-conventional therapy is helpful for the management of lower urinary symptoms secondary to BPH. Of course, what I would say to this is quite important. At this point, let me just say I've had experiences where this is an anecdotal experience. There have been some supplements that have really worked wonders. I will keep this because I don't want anybody to be misled. In as much as we practice what is standard and all that, we get some experiences and they are really begging for further studies. Personally, I've had experiences where people have taken some of dietary supplements, and what happened to them was more like magical. But then I would not advise that you embark on this on your own. Always relate with your medical doctor, your physician, and then whatever you're doing, let it be with their knowledge and their advice. There are some things that have been found to be useful. One of them I will mention is longevity. It has been, I've seen it to work wonders, but not it alone, usually in combination or as an adjuvant or in addition to some major other things that you are doing, okay? The fact that you're using surgery doesn't mean you may not require surgery or you may not require some more advanced approach towards your treatment and all that. But it might give you a better outcome. Some of the things that I've experienced are quite sensitive, and that might be misleading, and people might begin to take. If you may want to hear further my experiences on this, you may need to contact me. But I tell you, there are a lot of wonderful things happening, but they have not been proven. Of course, for all these things to be on record that certain people use them, to achieve this or that, there must have been some results, found out. So my plea will be to the appropriate authorities to look deep into this. Recently, the wife of the first lady, the wife of the president in Nigeria, was advocating that some traditionalists and all that, their activities should be looked into, and they should be embraced. And there's a way it was put, and I could see that. Remember the Madagascar hub for COVID-19 and all that. So some wonderful things are happening, even though they get being condemned. So I won't want to speak too much in this area. If you want further information on this, do not hesitate, because I mentioned earlier there are families that I had cause to congratulate for having some successes. And it didn't just come from just conventional orthodox practice. It has to do with the help of some support of some of these things, and amazing results, were achieved. So I think that's enough for that. Okay, we talked about watchful waiting. It is best for men with mild symptoms. Prostate, especially when we are talking about prostate cancer, that's the one we fear most. They behave differently in different people. There are some people, the rate of growth of their prostate cancer, the development is quite fast, while some very, very slow, to the point that you want to question the intervention you want to give. Maybe even the intervention can even affect their health more than not even intervening at all. And by the way, we're talking of enlarged prostate, benign prostatic hyperplasia. It's been known that it's not all benign prostatic hyperplasia that enlarge prostate that lead to total obstruction. There are different ways the prostate can actually enlarge. It can enlarge and causing pressure on the urethra, causing blockage. It can also enlarge without causing obstruction or blockage. So also there can be an in-between, whereas it is enlarging, it is causing some minor obstructions that, you take some medication and you get better relief. So as a result of this, the advice will be that you should relate with an expert who understands the way all these things, are, and be able to give you the best advice. Of course, when we talk of watchful waiting, we are referring to people who their symptoms are not really problematic, and somehow modifying their lifestyle and doing some things that proven to be helpful to them. So you don't want to take any drastic action until the need actually arises. Okay. So it consists of yearly exams and no active intervention, as you can see there. You keep examining them. For instance, someone does a PSA and the PSA is 20. And of course, the normal PSA shouldn't be it should be less than 4 nanogram per mil. Okay, so you find this guy, his PSA is 20 nanogram per mil, but he doesn't have any urinary symptoms and all that, But then you're wondering, could this be cancer, coming up? You scan him, you can't really see anywhere cancer is going. The fact that he has a high PSA does not mean that you should go ahead and start operating him or start giving him drugs, to deal with prostate. He's urinating fine. The only indicator is that he has a PSA that is quite high. So for such a person, you want to, repeat his PSA at regular intervals. Probably you want to start with repeating it after 1 month. After 1 month, you still find it at 12. Then you begin to wonder what's going on. Some of them, you need to evaluate them for maybe prostatitis. If they have infection, it's possible that that infection may be the reason why their prostate uh, specific antigen is elevated. Okay, there's also other factors that could innocently lead to elevated prostate antigen. For instance, sexual intercourse. If you want to do the test and you're just doing it after you have met your partner, you have had sex and ejaculated, definitely your prostate antigen is likely to be higher. So you want to make sure that you have abstained from sex for some days before you go for the test. So also some activities like biking, horse riding, and all that, anything that cause impaction on your prostate, when you're on a bike or you are riding horse or you are sitting astride something that is vibrating and there is a pressure that is vibrating your prostate. Your prostate antigen is going to be higher than what is normal, okay? So it is important that you are aware of this condition. Someone could be wrongly diagnosed of prostate problems because maybe from just the PSA that is high, not knowing that they have engaged in some activities. So also the rectal examination that you saw, before we do a rectal examination, we ensure that samples for prostate-specific antigen has been taken. If the blood has not been taken and you do a rectal examination, then you can't afford to run that test at that point. You have to give enough time for the effect of your rectal examination on the prostate antigen to have gone, maybe some days, like even up to a week, before you commit that person to do that examination as PSA tests. Okay, so at this point, you don't do surgery, you don't give any drugs. It may involve lifestyle modifications such as adjusting diet, evening fluid intake, medication use, and exercise patterns. Okay, this is more like healthy living lifestyle. Of course, what are the side effects of watchful waiting and some medical therapies? Symptoms may worsen or remain unchanged without lifestyle modification. Okay, I hope that is clear. So that's the essence of regular checkup and watching to see. Of course, there are medications you can use. I don't really have to go into that. They have their side effects. They have their characteristics. There's a way they cause relief to the symptoms and all that. Some of the side effects include abnormal ejaculation. Okay, there could be drug reaction, there could be weakness, there could be dizziness. In fact, blood pressure could really drop significantly. I remember a particular client who was on prostate drug. I won't mention the particular name. His BP was always crashing. So sometimes these prostate medications are better for those who equally have hypertension. So when you're going to introduce them, you may need to stop their antihypertensive drugs because these drugs equally can have effect on dropping their blood pressure. Okay, so we also have the ones like the 5-alpha reductase inhibitors. Okay, it is it helps to shrink the prostate, and it tends to reduce the need for surgery. So usually if the prostate size reduces significantly, then you may not want to bother with surgery, because the symptoms are relieved and the person can pass urine, as normal. The side effects would include erectile dysfunction and impotence, inability to have sex, lowered sexual drive, stroke and libido, ejaculation disorders in their various shades. So, and it also lowers PSA levels up to 50%, which can interfere with prostate cancer detection. For instance, if a proper assessment has not been made, okay, and someone is harboring cancer and the PSA is high, but you jump into taking these drugs, you introduce these drugs and this person is already taking it. Whatever PSA the person is supposed to be having, it can reduce it by up to half, up to half. For instance, if someone's PSA is 8, you can, because the person is on this drug, which is expected to make the person have a relief of the symptoms, you do the PSA, you find out that the PSA is low. Okay, remember I mentioned earlier those factors that could make the PSA higher than normal. Now, these are factors that could make the PSA lower than normal, and you must be aware of those factors. So when you're doing PSA test for someone, you want to ensure that they are not on drugs like this. Okay, so now what are the treatment options we have here? We have what we call minimal invasive therapy, which includes transurethral microwave therapy, because this is an instrument that is passed through the urethra, that's the penis, and it gets to the prostate, and it is fired. As it is fired, the microwave is made to hit the prostate tissue, and it appears to be burning off the prostate tissue. So it's more like microwaving the prostate. That's essentially what it is. Let's not spend too much time on that. This is what the machine looks like. And when it is passed through the prostate, you can see this section of the prostate. This is the section of the prostate where you have the, what do you call it now? The microwave, the heating elements, okay? And as it hits the prostate tissue, it tends to destroy it. By so doing, it is reducing the size, and one is able to pass urine frequently. Of course, this can only be done for enlarged prostate, not for prostate cancer. Okay. There's also what we call transurethral resection of the prostate. This one is an instrument that is passed through the prostate. This time around is not for heating, but to be biting off the prostate tissue, cutting and removing it. It has a cauterizer effect whereby it, when it bites off, it also stops bleeding at the same time. Modern surgery is done mainly that way. And this is what it looks like. Of course, you can see the tip of the instrument, at the prostate itself, and it is biting, chopping off the prostate and withdrawing the prostate tissue through this tube back out into out of the body. So we also have a laser therapy. This it tends to vaporize away the prostate. Laser have powerful energy that when directed to tissue, it makes the tissue just dry off, vaporize, and become whatever, air, smoke, whatever. It's just like you're burning up something. Very powerful effect. So what are the side effects? You can have problem with an ejaculation. In other words, as you're ejaculating, instead of the ejaculate coming through your penis, is going into the bladder. You can also have urgency, frequency, difficulty passing urine. There could also be blood in the urine. And of course, you can also same have urinary retention, because the site where the surgery was done can eventually heal and become fibrotic and obstruct. It obstructs. Where you have wound within a hole, if that wound heals, that hole can block all the way, all the same. So usually to prevent this, probably the catheter is usually put in place as long as the healing is necessary to take place. The catheter is withdrawn too early, there can be a problem. The healing can take place and obstruction will ensue. And then it may require further surgery to correct that. So this is how the laser looks like. First, it is fired into the tissue, and the tissue is more like losing substance. This time around, it's not like the heating type. Is also not like the one you chop off. You slice in bits the prostate tissue. So this is the one open prostatectomy. This is what is commonly done that I'm aware of, and I've been part of this surgery several times, where we access the prostate through the abdomen. I talked to you about the incision that I made on the abdomen when you are cutting open. So you made an effort to get to the prostate with your hands, and you remove that. So it is typically performed on patients with large prostate volumes. When you have very large prostate volumes, all the method mentioned earlier may not be helpful, because the kind of challenge you're going to face from the size, you may end up just removing probably less than 50% of the tissue, and you cannot go further, yet it's still there. Because there's limit to how you can maneuver the instrument you're using, and some other challenges faced. So it is effective for men with very large prostate glands, bladder, diverticular pockets, stones. And why do we say this? Now, you have the opportunity of viewing the bladder itself. So if there are diverticular, you want to remove the diverticular during the process of the surgery. And if there are stones in the bladder, you remove the stones from the bladder. And it is like using a stone to kill many birds. So what are the side effects? You stay longer in the hospital because healing takes longer. There are more tissue damage. The operation field is wider. You are cutting the abdomen, and that space will take its time to heal and all that. There's also more risk of blood loss, and the person might require blood transfusion greater than other procedures we mentioned earlier. And this is what it looks like. I have a more picture that is graphic, a more graphic picture than this. So I remember the other presentation I referred to that I did in 2020. The slides were quite graphic. You see real life, and this is a drawing, this is a painting. But that one was real life. You see blood on that. So I don't want to do anything graphic here because of the sensitive nature. Okay. So you can see practically what it looks like removing the prostate gland with the hand. Yes, this is what I know one of my mentors does this, and before he used to encourage me that no, there's no big deal doing this surgery. You just ejaculate and all that. So it's about mind and all whatnot. So we have this we call external beam radiation for prostate cancer. Usually for those with cancer, this radiation is directed towards the prostate gland from several angles. So it rotates around the person from several angles. Of course, it will have its own side effects. Okay. The slide is now moving. Okay. We also have another method we call a permanent prostate brachytherapy. There are seeds that are introduced into the area where you suspect the prostate cancer to be. And these are how the seeds look like. They'll be there releasing over several months. They'll be releasing some radiation to kill the cells that are the prostate, thereby attacking the bad cells and also reducing the size of the prostate. That's another method that we have. Okay. Involves placing many radioactive seeds within the prostate to treat prostate cancer. During the procedure, an ultrasound probe is placed in the rectum to help guide the placement of the seeds. The seeds emit radiation that dissipates over a few months. So, in summary, we have talked about the prostate and how it works. We've talked about enlarged, prostates. We also talked about the treatment option, one of which is watchful waiting and some medical therapy. We also talked about some minimally invasive surgical therapy, heat therapy, that's the microwave stuff, transurethral resection of the prostate, that device that is put through the urethra of the penis to access the prostate, and you begin to chop off the penis. Also mentioned the laser one, which makes the tissue disappears into thin air. We also have the surgical one, which is open prostatectomy. We also have the laparoscopic, it's a robot-assisted open prostatectomy, where you have so many holes made through the abdomen where the instrument passes. I have a picture to show, but it's not on this slide. Okay, so it is important that I mention this to you, and I want it to be like a take-home advice. Okay, first and foremost, this is more of an educative presentation. I am not your doctor. You need to relate with your doctor, to check your health and ask questions, plan with your doctor. I'm not asking you to come to me. You have your own doctor, so meet them and relate with them. Of course, primary care doctors and urologists tailor the frequency of testing and aggressiveness of treatment to the individual's risk, needs, and desires. When you discuss with I'm a primary care, physician, a family physician. So our job is more like, the first-hand medical personnel you're gonna meet. And usually we're the ones that will refer you to a urologist if they need, there's need for that. So urologists are the specialists who will actually take care of the situation when we get them referred to them. Patients like that, we get them referred to them. So what we do at this point is to assess your stage, your situation, your presentation, want to look at your risks and all that, and want to marry it to the approach we want to use. For instance, you don't require a sledgehammer approach to deal with a problem that should even be overlooked. So that is what it means. We have different behaviors of prostate. There are some who don't even need to be touched, and there are some who needs to be dealt with aggressively, especially when the prostate problems is happening to someone at a very young age. Usually prostate conditions are more common above the age of 55. Recently, I conducted a test for people in a particular community. That was that's exactly a week ago. It was last Sunday precisely. So it's a week ago. And Those that tested positive, all of them were in their 60s. The youngest of them, I think, was 62. Yes, that tested positive, 62. Those that were 40 tested negative, 50 something 50 tested negative. But testing positive started from 62. I think they were up to 9 of them or so, 9 or 10 of them that tested positive at various degrees, various levels. So we'll be committing them to further investigation to assess their risks, to assess their condition, and to look at what to be done next, especially as relates to the degree of whatever is going on. At this point, we're not making a diagnosis yet. We're not saying they have cancer. We're also not saying they don't have cancer. So that's just the impression, but their PSA levels are high. So we have to investigate further to exonerate them or to diagnose them. So when to start screening is generally around age 55, but doctors may recommend it earlier based on risk factors, especially like in America now. They would encourage those who are Black American, African American to do screening much earlier because the risk of having prostate cancer is about 75% higher in Black African American than in white Americans. So that is it. Then PSA level above 4 nanogram per millimeter narrowly signals that further prostate cancer investigation is needed. PSA levels can vary widely and do not guarantee that cancer is present, but the test does help catch cancer early when it is more treatable. I hope this statement is very clear. The fact that you are being tested and found to be positive doesn't mean you have cancer. It also does not mean you don't have cancer. But the benefit of the test is that if at all you have cancer, it is being detected at an early stage where treatment can take place. Like when I started this presentation, I mentioned those people, who lost their lives from prostate cancer. One of them actually had the symptoms 10 years earlier, but never visited the hospital because he probably wasn't his nature to visit the hospital. He was using other means, but when it got so bad that he was losing weight and everything was getting so bad, in fact, they had to push him and force him to the hospital. At that stage, the cancer had gone too far. So, but assuming that 10 years back, he came to the hospital, he probably would have benefited from something. It could even include surgery, and the cancer itself would have been cleared completely. And today he'll be living, fine and all that. So that's what it really means. Catching it early is very good. So a prostate biopsy is often the next step after a high PSA reading. We saw the biopsy earlier. A bit of prostate tissue is extracted through a needle, then examined under a microscope to confirm whether cancer is present and how aggressive it is. There are two things. Is there cancer? Okay, it's not enough to know that there is cancer. Not all cancers should be treated equally. If it's an aggressive cancer, you want to be aggressive with it. If it's a gentle cancer, you also want to be gentle with it. In fact, if it's a gentle cancer, you really want to observe because depending on the age, remember we mentioned that it's usually common around 60s, 70s, 80s, 90s, more common among them. So now, dealing with cancer in those age groups, there are instances where you don't even really want to do anything. I'll give you an example where a man aged 102 years comes to me and we are diagnosing prostate cancer. Please, I'm not going to do any radical intervention. It doesn't matter how advanced the cancer is. I won't do any radical intervention. Whatever I will do is going to be more like supportive counseling and life modification. What surgery do you want to be doing at age 102? Okay, you probably are going to even kill the man before his time when you proceed with radical, prostatectomy. So that's the idea. And if we are dealing with someone who is probably age 50 and he has cancer, definitely for the cancer to be occurring at a more lower age, then it means it's even a more dangerous prostate cancer. And usually people like that are known not to live long because the survival rate of cancer, the 5-year survival rate of cancer, for some condition, for some people, is quite low, whereas for some it's higher, and it's higher for those who are detected to have cancer at a younger age than for those detected to have cancer at an older age. Okay. In most cases, where the cancer has not spread beyond the prostate, it can be successfully treated with radiation surgery, or if slow growing, with active surveillance. What this means is this: if you find cancer that is aggressive, we're going to determine that. You may just decide to remove it. But if you find cancer that is there and is not behaving as if it's really cancer, it's growing, but the rate at which it is growing, definitely the person might clock probably 150 years before it causes any problem. Why do you want to intervene? I hope you get the idea behind the management of cancer. So that has been causing a lot of controversy among the experts in recent times, such that a lot of interventions that are taking place are being queried, they are being questioned. So you must really study the nature of the cancer. So just being watched. The most common surgical option is prostate removal, performed laparoscopically through small incisions with robotic assistance that I mentioned earlier. Patients usually go home the same day or after an overnight stay. Now, any treatment runs the risk of affecting sexual function and urinary issues, at least temporarily, and this must be discussed with the patient beforehand. These risks have lessened, that is, have reduced in recent years. What this means is this: in as much as you're doing some good for this patient, there are some side effects that you cannot avoid. One of them is sexual function. At least during the management of prostate cancer or benign prostatic hyperplasia, there will be times the person will be on urethral catheter. There's a tube that is passed through the urethra to collect urine into a bag, or to help urine, bypass the urethra for the moment. It may not be attached to a bag. It may also be attached to a urine bag. Depends on what approach the physician decides to choose. So that period, definitely you don't expect anyone to be sexually involved with anybody when he's having a catheter in. And some of them might carry this catheter for days, weeks, or months, as the case may be. That's why it is said that at least temporarily. And I've known people who have kept their catheters for more than a year, and for some, it's more like a permanent thing until the day they hope things will get better and they have to get it removed. Okay, you must discuss this with your patients, because for some people, they will prefer to die than not to be having, sexual affairs. And if you get them involved without their consent, then you have done injustice to them. Okay? So there is no proven diet to prevent prostate cancer. So doctors recommend the same thing as for overall good health: a sensible diet, regular exercise, and not smoking. Of course, also reduce alcohol intake. If you're able to abide by this and you keep a healthy lifestyle, in other words, you do exercise. If you're not active enough, you don't smoke, you don't drink alcohol, and your diet is sensible, not junks, not sugar loaded, okay? And not all these processed foods and all that. If you minimize that and the quantity of your food is normal, and you avoid eating late, very much late into the night, you definitely will be leading a better life, especially when you also take fruits and vegetables in the right quantities and you take water in the right quantity. Definitely, this is what we call healthy living, and you feel happy and you relate socially with your partners and you're fine. You don't get bored with some issues. You're not stressed and all that. Definitely, your risk of having prostate cancer will be much less. So now, I want to startle you a little bit. Um, I got wind of this some years back, and this was on a television program. And I was wondering what would be happening. This was in the social media anyway, the television program. Lo and behold, it is said that having sex reduces the risk of cancer. A number of studies have found that greater ejaculation frequency is associated with a reduced risk of prostate cancer. One such study was co-authored by Lorelei Muxi, professor of epidemiology at Harvard Teaching Hospital, Chan School of Public Health. The 2016 study found that ejaculating more than 20 times per month reduced prostate cancer risk by about 20% compared to ejaculating only 4 to 7 times per month for both men in their 20s and 40s. This is a fairly sizable effect, she said in a March 2022 article from Family. So I've done some research on this, and it is not one study, not two studies, not three studies. A lot of studies have been done in their various categories. They have even checked at what age do we really have this effect manifest. It was even shown that those who are quite sexually active, age 30, 20, 30, their late 20s to 30s, the 20s, 30s, has a serious impact on reducing their chances of having prostate cancer. It may seem like a joke, but this is serious. If you want to know further about this, you may contact me and I'll give you all the details, all the studies that have been done. And finally, I want to talk about, maybe not finally anyway, I want to talk about the role of human papilloma virus, commonly known as HPV, okay? Commonly known as HPV in the in the etiology of prostate cancer. Before now, what we used to know is that cervical cancer is mostly caused by human papillomavirus infection, to the point that a screening is done and there is a vaccine that is meant to prevent women from having cervical cancer. So in this case, this is making me to kind of that to kind of probe into the role of this vaccine for men too. I think the scientists or the stakeholders should also evaluate the role of this HPV cancer, HPV virus vaccine. I think there should be a study. If I have the opportunity and I have the support, I can do this study. The role of, what do you call it now? The role of the vaccine, because men also deserve to be protected from this prostate cancer. Only God knows. It's very possible that all these cancers, majority of them actually have been caused by this virus, you know. But I just stumble across this, and I believe something will be done in that direction, and something positive at that. So having said this, I think we have come to the close of this presentation. If you have questions, I would be glad to answer them. You can write them at the comment section. You can share the video, let people get to know about this if you think it is useful and you can benefit from it. I think you are covered. Like I say, visit the hospital. Too many people are dying from ignorance, from not doing the regular checkups and all that. So till I come your way, I want to enjoy you, encourage you to stay fine, stay healthy, and do not joke with your medical results. Do not joke with your tests, because it's important that you run tests, do the necessary investigation so that you can stop some of these terrible things from happening. So do have a wonderful day. Bye till I meet you next time.